Thank you to SAME for this opportunity of presenting our study, Delirium Recognition in 1,584 older ED patients. How many could have been sent home? In keeping with the University of Toronto policy, I have no conflicts of interest to disclose. But I do want to gratefully recognize the support primarily from the Schwartz-Reisman Emergency Medicine Institute. And of course, geriatric emergency medicine research is a team sport. I thank all of my collaborators and co-authors from across Canada and the UK for help with this study. We couldn't have done it without such a strong team. I thank you very much. Despite the fact that unrecognized delirium has a threefold increase in mortality for those who are discharged home, recognition of delirium in the emergency department remains poor. However, the delirium recognition by ED staff has not been assessed in a national multi-center study, and the management plans of ED staff for patients with unrecognized delirium have also not been assessed. Therefore, we set out to measure the rate of delirium recognition by ED nurses and physicians, and also to measure their intended management plan for older ED patients with unrecognized delirium. So to accomplish this, we conducted a prospective observational study, which was a planned study of a randomized clinical trial that followed consort methodology, and the protocol for the randomized clinical trials can be found at clinicaltrials.gov, number NCT 034-23875. We recruited 7 academic emergency departments from 4 provinces across Canada and conducted this study in English and French. We included patients who were 65 years of age and older, and excluded those who had an ED stay of less than 4 hours, were critically ill, visually impaired, or nursing home residents. Our data collection involved experienced and trained research assistants who conducted the confusion assessment method on eligible patients. Subsequently, the research assistants interviewed the ED nurse or physician and asked if the patient had delirium, how confident the staff were that the patient had delirium on a 10-point Likert scale, and also their confidence that the patient could be safely discharged. These interviews were conducted blinded to the research assistants' CAM assessments. However, once the responses about delirium recognition had been recorded, ED staff were notified of any missed cases of delirium for safety reasons. And now for the results. Drumroll please. We were able to recruit 1,584 older people, of which 1,495 had complete data. Their mean age was 76.5 years, and 49% were female. In this cohort, we found 79 patients, or 5.3%, had delirium as diagnosed using the confusion assessment method. Further, nurses in our study assessed 1,465 of the 1,495 patients. So, of the 76 patients with delirium that nurses assessed, they recognized 34 or 44.7%. The 95% confidence interval ranged from 33.3 to 56.6% for delirium recognition. Further, nurses felt that 11 of the 42 patients that they assessed who had unrecognized delirium could be safely discharged home. That's 26.2% with a 95% confidence interval between 13.9 and 42%. Now, physicians in our study assessed 20 patients with delirium, and they recognized that delirium in 10 out of 20 patients.
For a delirium recognition rate of 50% and a 95% confidence interval ranging from 27.2 to 72.8%. The physicians felt that 2 of the 10 patients with unrecognized delirium could be safely discharged home for a 20% rate and a 95% confidence interval, given the low number ranging from 2.5 to 55%. Now, of course, the ED staff in our study knew there was a study going on. This creates a potential Hawthorne effect, and that creates a conservative bias. So the delirium recognition in our study may have actually been better than it would have been in clinical practice if the study wasn't going on. Despite this Hawthorne effect, delirium recognition remained less than 50%, and a significant number of those patients may have been discharged home if they weren't participating in the study. Further research to find novel ways to improve delirium recognition is urgently needed. I thank you very much.